Just allow my phone to go silent. I will be recording today. Send a message to me in the chat box privately if for any reason you want to comment or something that that you wish to say out aloud, not to be recorded, and I'll make sure we deal with that. But the reason for recording it is that so the people who are unable to come today and others can listen again. And we'll put the recording on the website. So just let me know if that's a problem, or say silent if if that's the alternative. So I must move on. That's, I hope, a quick summary of how we can take part today in the next 55 minutes. Our webinar seminar today is called The Patient Voice in Primary Care. How can engaging with patients make a difference to their experience? And I'm really pleased and proud that Paul Devlin, who's the Chief Executive of the National Association for Patient Participation, is leading our seminar. What we'll do is we'll have a brief overview from Paul for about 10 minutes. I've called it part one, a bit of background, a bit of what goes on. Obviously, Paul will explain how the National Association works, but that's not the only purpose at all of today. And then we'll stop just for a few minutes for any questions you might have at that point, just 2 or 3 minutes. And then we'll move on to Paul's second part of Paul's presentation, which is about looking at some resources and some good examples that Paul's aware of, and I think you will be as well, I hope, of where engagement in primary care and GP practices has made a real difference. And that will leave us a good 20 minutes or more for discussion at the end between all of us. So that's broadly the agenda, a very simple one. Again, I'd like to just welcome you all, and I'm going to, in a second, technically move over to Paul. There's a slight pause here where technically we move over to Paul. Are you ready, Paul?
I am. Thank you very much. Can you hear me, Martin?
I can hear you, and I'm assuming everybody else can. And can you find your own slides? You can. So over to you, Paul.
So hello, everybody. Really pleased to be able to present this set of slides. It's a way, as Martin said, to hopefully get some discussion and debate going. So just for about 10 minutes, the first set of slides. That's me, Paul Devlin, Chief Exec part-time for the National Association for Patient Participation. I'll say NAP from now on because it's quicker. And our website, if you want to look at that, is www.nap.org.uk. And we also have a Twitter account, which is @PatientParticip. So do please follow us on Twitter if you can, and we do have a hashtag for today's session. The hashtag is patient engagement. So I thought it would be helpful just to say a little bit about NAP, who we are, what we are. I know some of you will be aware of us, others may not be. We're the UK's only umbrella body for patient groups in primary care. So our focus is on primary care. We're a charity and have been going for about 35 years, and something like 1,400 PPGs, patient participation groups, are members of NAP. So that means there's a reach from our membership to something like 13 million patients. It's a big reach. We aim to, pretty much our focus is about promoting patients and PPGs as participants in decision-making in the NHS, but also for individuals, participants in their own self-care. And we do this particularly providing support, guidance, networking, etc. For PPGs. But we also engage with other national organisations, national stakeholders. So we work with organisations like NHS England, NHS Improvement, the Care Quality Commission, CQC, and some of the Royal Colleges as well. So it's an important way for us to operate nationally. So that's all I want to say about NAP at this stage. So why should we engage with patients in primary care? I think sometimes we might take it for granted that of course we should, but it's worth just doing, I think, a reflection. At the moment, there are some key drivers. The NHS's 5-year forward view is very clear about saying patients must be able to influence healthcare as a key partner. And we know that in England, since the beginning of April, it's become a contractual requirement for GPs to ensure their practice has a PPG. We also know, I think there may be colleagues from other bits of the NHS with us today, clinical commissioning groups, CCGs, and NHS providers also have a legal duty to engage and to tell people how they're doing that as well. But I think more fundamentally than those kinds of reasons, we are all consumers of the NHS. It is our NHS. And bluntly, we've got more to offer the NHS than just our illnesses. So, if I can move us on to some of the ways of engagement that do take place at the moment, because I think engagement can be many, many different things. This isn't supposed to be a comprehensive list, but there can be things like focus groups and events. The friends and family test is a part of engagement, as are patient surveys. Complaints and compliments can also be seen as engagement. They give us important feedback. And indeed, for clinicians, when they're in a one-to-one consultation with a patient, they're doing some engagement. And then, of course, from where I'm coming from, there's the importance of patient participation groups. So to say a little bit more about those groups, patient PPGs are groups of active volunteers. They are predominantly based in GP practices, so they are made up of patients of a particular GP practice, and they work in a mutually agreed relationship with practice staff, including GPs. They're built on mutual trust and respect. Most PPGs operate with face-to-face meetings. Some either enhance that with what we would call virtual groups, so using electronic means, indeed exactly the way we are having this webinar ourselves. But there are some groups that operate solely as a virtual group. We know that some dental practices and pharmacies who are technically part of primary care, they also have PPGs. It's a much smaller percentage though. And we also know that many clinical commissioning groups work proactively with PPGs in their areas. But PPGs vary. Like the practices that they're based with, PPGs are not all the same. And I've listed some examples of the differences that there can be. So if a PPG is based in a city or an urban area or a rural area, some larger practices, some smaller practices, the PPG will be different. There are, for many of us, still standalone GP practices, but more and more people, their practices are working together as a federation, and that may change the way PPGs operate. We do know that good work is done by many PPGs in these varied situations. However, I think it's important to say that there is a very strong correlation between good PPGs and strong practice support for them. And the practice manager, and again, I don't know if we have any practice managers joined with us today, but the practice manager is a particularly key person to enable good PPGs. So some of the barriers, and again, there may be colleagues on the call who have other examples of these, but here are some barriers that I've seen. First off, there may be a lack of commitment from the practice, full stop, perhaps just not seeing that it's worthwhile, or assuming that they already do engagement good enough and that they listen to people all the time, so why would they need a PPG? A lack of resources, including time, a lack of clarity and shared understanding of what engagement is and is not. And that sits both with the organisation, the practice, and with patients. Something I hear a lot is that PPGs are not representative, and they're not, but they should not be dismissed solely on that basis. They still are one valid voice. Doesn't mean to say that the practice shouldn't seek out other voices too, but don't dismiss a PPG because it's not representative. And some of the experience that we've seen is that organisations might be more focused on enabling their staff to do the best job they can for the patients, rather than taking a different approach and focusing in on the patients directly. So engagement, we're saying, requires commitment, requires some energy. There are some real benefits that can come from it. The notion of PPGs, as an example, being a good communication route. Health promotion, I'll talk a little bit more about that later on. Co-production, this thing about actually working alongside patients to involve them in the development of work. PPGs can be great critical friends. It's important that they're not more critical than friend or more friend than critical, but a good critical friend is very helpful. And they can bring feedback on services, patient experience, and an independent voice. And importantly, particularly at times when we're going through lots of change in the NHS, PPGs are an important voice to engage and involve in changes. And my final slide before I pause, and we take some questions and comments, is to reflect on the importance of the relationships. Investment needs to come from the practice or organisation, and there's some examples there about time, practical things like posters, leaflets, some encouragement and support for patients to say you might want to join this, and some financial support. There aren't just pots of money available. PPGs will need some financial support for carrying out some of their activity. And as a PPG, it's important that there are investments that are considered too. Volunteer time, the understanding of the practice and its priorities, and also remembering that it's not just about me and my experience. I'm there to represent others. And I've suggested there that we should aim to build patient engagement into the standard systems. So at that point, I'm going to pause, and I'm just going to hand back to Martin so that he can chair some Q&A.
Thank you very much, Paul. So you remember in our introduction, and welcome to those people who arrived a little late for technical or other reasons. Apologies if that was a problem. Sarah has a hand up, but I think, Sarah Wise, that might be just from the practicing of putting your hand up. So we've just set aside just 2 or 3 minutes now just to take stock of what Paul's saying and his background information. So now's a chance to ask a question or two. So you can either do that by typing the chat box to everyone or to myself as host, or just raise your hand and you can pose a question or a comment over the phone or however you are speaking. So don't hold back. Barry. Now Barry, oh, and Annie, so I better take Barry first. I think I saw Barry's name go up first, and then Annie. If you could just in a moment introduce yourself as well, so we know what background you have, because what I didn't say at the beginning is that from my list of people who are here on the web seminar today, it's a really rich mix from those working in primary care, those working in other aspects of the NHS, and those not working or not working in the NHS at all, but with a strong role within primary care. So, Barry, you are either call-in user 5, 6, or 7, and I've no idea. So, if I unmute you all, can one of you, who is Barry, speak? Hello, Barry. Barry, are you able to speak? We can't hear you. Oh, it's a very poor line, Barry. I think, Paul, we're going to have to pass over and see if you can redial or something in a moment, because I can't pick you up. Sorry about that, Barry. Annie, would you like to speak up?
Oh, hi. Hello.
Yeah,
can you hear
sorry.
me?
Yes, we can hear you. Sorry, Barry can't be heard, but you get first dibs.
Okay. My name's Annie Paddock, and I work at Somerset CPG. I'm the primary care implementation manager there, the strategy implementation manager there. But I was just interested in the issue around representation of PPGs and how representative they are. And I think another slide mentioned that some PPGs have gone down the road of having a virtual PPG. And I just wondered if there had been any work or any information on whether going down the virtual route had encouraged a wider demographic to join the PPG, or whether that had changed the nature of it.
Yes, so thank you. Should we just see your response to that, Paul? And we will open this to the rest of the group in the second part when we've got more time to discuss. So the contention or possibility is that virtual groups, online groups, and so forth might widen representation. And he's been quite scientific here. I think might be saying, is there any evidence, or do we have any best practice? Or
yeah, I think thanks for the comment, Annie, as well. It's I think there is some anecdotal evidence that it works because by definition, going to a virtual engagement means that there are demographics of people who perhaps are unintentionally excluded from the from a face-to-face meeting. So, for example, if a PPG meets on a Tuesday afternoon, by definition, there will be a whole bunch of potential members who can't physically attend for other family or work commitments. The virtual group enables that them to be able to contribute. I think the other thing that there has been some work done on is the fact that different groups of people, I'm thinking particularly in terms of younger age groups, and I know this is generalization, but actually there's evidence about how different age groups prefer to be engaged. And what is very clear is that for many younger people in particular, engagement through using social media and electronic means is their preferred way of being engaged. So they may not want to turn up to a meeting, but they would love to be able to take part by their mobile phone. And what we have seen, and I'll mention this in the second section about some of the best practice, is that PPGs, there are some PPGs who have identified their own lack of representation and sought to do something about it. So actually targeting a part of their practice's patient population, their local community that isn't represented, and seeking to try and engage with them, whether directly or through working with another community group or local charity.
Okay, thank you, Paul. We said we're just going to take a couple of questions now. I'd like Simon has typed his question. Thank you, Simon. I'd like to just take Simon's question in the second, longer questions and answers, because I think there might be some things you're saying, Paul, that would inform that. So Simon Chandler's question was about broadening involvement, both in the topics and the involvement of people, I think. But I wonder if you could just respond to Barry, who's typed his question, because we weren't able to hear him. I'll read it out for everybody as well. Barry wanted to ask about the contractual requirement for PPGs, and I know that's changed, as Barry said. Let me just read back up at it. In the past, Barry's saying practices were paid to do PPG work, and many practice managers were incentivized. Since it's now a contractual requirement, Barry's contention or experience is the practices are doing the bare minimum. Have you any responses to that, Paul?
Yeah, I think from a technical point of view with the contract, from NHS England's perspective, whilst there is no longer a separate payment for doing patient engagement, the way the contract is written, it says that the payments that the practice gets should also, they reflect an expectation that they do engagement. But Barry's absolutely right that there is now not a separate payment for that. I think it was an incentive for a good number of practice managers. What we have to do is work against that just doing the bare minimum. And I think that comes from us being able to help practices understand the benefits of doing that work and putting the investment in, and for PPGs to be able to show that it is worth investing more than the bare minimum. I think that what Barry's flagged, though, is something that we need to be careful about. We have to be aware of this, and we have to be able to challenge if we think that practices are then just falling back to doing the bare minimum. And if you remember, I had a slide which mentions the fact that the practice manager is a critical person for enabling good PPGs. Similarly, within a practice, if the practice manager is not being supported and is not supporting PPGs, that can be part of what gets in the way.
Okay, thank you, Paul. We've had another question which I'd like to defer as well to a bit later on from Sophie Wickens, which is around some practice staff's beliefs around how well members of the public can engage and their ability, perhaps, or capability of doing that, which I think would be quite controversial, but a very honest view that Sophie picked up there. So let's cover that later on as well. But in fact, let me, as a reminder, whilst we listen to Paul thinking these questions over, please do create your own responses to questions that people are raising as well. So these can be questions for everybody, not just for Paul. So please try and do that if you want to, alongside listening to Paul's second short part of the presentation, which is around some best practice examples and some of the resources that NAP also recently produced. So over to you again, Paul.
Thanks very much, and I'm looking forward to the conversation around Sophie's point, because it's a really important one that she's flagged there. So I wanted to talk about one particular resource that is also a gateway to many other resources that can help, and it may be something that we then reference in some of our later discussion as well. NHS England commissioned NAP a couple of years ago to develop a resource to support the development of PPGs in practices. And it's a resource that went live at the beginning of May. I hope for some of you it's something that you recognise, but I wanted to talk a little about it because it's something that is available, publicly available to everybody, and it attempts to provide a set of resources that can support with some of the challenges, including some of the ones we've already been discussing. So it's called Building Better Participation, and it's a suite of short resources. So there's an overview document, and then there are 4 areas which are separate standalone pieces. So getting PPGs in place, helping PPGs work well, knowing and working with patients, influencing beyond the GP practice. And the suite also includes a self-assessment sheet which is offered to PPGs and practices. I've also said that since we produced that core resource, NHS England commissioned us to produce an additional module called Making Online GP Services Work, which was about us helping PPGs think through what they could do in relation to online GP services. So within each area, there are between 3 and 7 goals, and each of the goals is about a way in which PPGs in their practice can demonstrate what they are doing. So there are examples of things that PPGs can do that are drawn from the real experiences of real PPGs. I mentioned co-production earlier. The design of this document very much involved something like 30 plus PPGs and some CCGs as well. And it went through a number of processes, including going through the proper plain English process as well, which is very, very good for the end product. It's a little dispiriting when you're the writer who thinks they've done a really good job being clear. Within each goal and area, what we also have are a link to a range of resources that are available, and those resources are drawn very widely. They're not just NAP resources, they're much wider than that, and they are all available electronically as well. I'll say a little more about that in a second. Critically, this is not a compulsory process. There was some discussion, I think at the start, NHS England was quite keen that there was something that was compulsory. Our sense, and when we tested this out, not only with our members, but also with practice managers, was don't make it compulsory, it won't get done. It would just become yet another thing that was being demanded. So what we've done instead is design it so that it can be dipped into. That in part reflects the diversity of PPGs and practices. We know that a PPG may not have the time to go through loads and loads of parts of the areas, so they might want to major on one or two goals. It may be that the PPG is very happy with the way it has got established, it's well established, but knows it needs to work on one area and support the practice in doing that. It's also designed so that it can help practices working with PPGs. And in terms of some of the comments that we'll come on to about the attitude of practices, it may be that this kind of tool could be helpful for them to actually work out how they can engage with people. It's about self-assessment, not external critique. The last thing that practices need is somebody else coming in and judging them. There's plenty of that going on. It's about us doing that as a piece of self-assessment and reflecting both the practice and the PPG. And just to say, obviously, it was designed for PPGs and GP practices, but it's adaptable to other organisations. I know of some CCGs who are already making use of it in supporting their patient engagement more widely than just working with PPGs. Where to get it? If you're a NAP member PPG, you get the free hard copy. Otherwise, it's available electronically. It's on the NAP website. For those who are on the phone, it's www.nap.org.uk/bbp.html. And obviously when the materials come around, you'll see that. The online versions that you get, you can obviously choose to download a hard copy, print off a copy if you want, but it is fully usable online. So all of the resources that are listed, you can hyperlink directly to them as you're working online, which makes far more sense for many of us these days. So, slight shift. I wanted to give some examples of what effective PPG activity can be, and I'm sure others will have examples of this. But the next three slides have got some of these. I won't talk about all of them, but I'll just highlight some of the sorts of approaches. So the PPG doing a kind of mystery shopping survey to get evidence about what the experience of patients is, about how long it takes for a practice phone to be answered, for example. A PPG, and this perhaps goes back to Annie's question in relation to representation. One PPG that I was aware of liaised with a local school, brought a student onto its committee, And as such, that gave them a way into engaging with students and younger people that has continued, and it has become something that students, particularly interested in health, have engaged with. There's an example there again in relation to some of the representation work, where a PPG recognised that within their local community, their Turkish community had a particular need for translated materials and standard letters. So rather than just knock at the door of the practice and say you should do it, the PPG went and got it organised and were able to work alongside the practice in that. There's an example, carers are particularly important, an example where a PPG survey helped identify carers within the patient population so that the practice could then provide them with supported information. An example of a PPG facilitating a group for local homeless people who were not necessarily being able to access services. Very practical one where there was an ineffective PA system in a practice, the kind of thing that everybody finds really irritating, and it didn't kind of get to the top of the list. The PPG managed to get it to the top of the list, got it upgraded, and made sure that staff had been properly trained in its use. And then just a final couple there. A really exciting one that won an award earlier in the year, an Oxfordshire PPG, carried out some research into maternity service needs. They did a proper piece of research, and as a result, their evidence was presented to the CCG, and the CCG, as the commissioner, on the back of that piece of work, funded an additional 19 midwives locally. I think that's a real impact. And there's examples there of a PPG focusing on people with long-term conditions and their support needs. And finally, I've mentioned that many PPGs run local health promotion and public engagement events. It's something that is part and parcel of their general work. So the final slide before we go back to more of a discussion is to quote a founder member and former NAP Vice President, Joan Mant, who summed up really, really clearly, patients have more to offer doctors than their illnesses. And if we can do anything through the work of NAP and PPGs, it's about enabling some of that more that can be offered to actually get into practices and be taken up by doctors and also other health professionals. So I'll stop at that point and hand back to Martin for the ongoing discussion.
Thank you very much, Paul. I hope that both parts of Paul's presentation have been informative, and as I said, the second part was aimed to stimulate our thinking about where engagement has worked. I've been picking up and looking at the chat box, and of course there'll be some opportunities to ask you questions as well. But in the chat box, we've got, I think, 2 or 3 things have come up in the early and the latter part of this afternoon. One was around representation that came up early on, and we just touched on it around virtual groups, maybe, but maybe not always, partly addressing the issue of representation. And Paul did make the point that let's not dismiss the work of PPGs where they're not representative, but let's hold some high standards and expectations about that. Simon was unable to ask his question earlier on, so he's typed it. And one of his comments you can see in the chat box, Simon, is really about variation. Some PPGs are excellent and can engage and use materials. Others just have a mailing list. And I think if any of us live locally and have aspirations for our own PPG or are working in the system, we'd like to see high quality representation everywhere, not just in some places. So I'd like us to see if we can address that. We can reiterate the problems, which I think is great, but it would be great to hear some examples from people or some ideas about how we can improve that. And Sophie Wickens' comment or question, which you can see in the chat box, is around the experience of some practice staff saying, as it were, perhaps confidentially, or certainly not to to their population, that they don't believe the skills or educational levels are there for people to participate as equals. I'd have lots to say on that as well, I think. So we've got 3 topics and more probably as well. So I'm going to invite people to, including Paul, of course, but let's see if anybody wants to respond to those by in conversation to any of those 3 topics, which I know have been raised. There might be others too. So please do put your hand up. Annie, I think you got your hand up from last time. Annie Paddock.
Oh, sorry.
That's all right. And Simon, Simon Chandler, just pop your hand down unless you are going to respond. Because thank you. So now we've got a blank field. Does anybody want to put across a viewpoint, or particularly some interesting experience where they've seen some work improving those issues? Expectations of staff in primary care and practices, representation, and also the variability that we're seeing now. We're listening to people from different places. Sometimes, unless you're working in the field, you never know how good or bad your own experiences compare with others. So, anybody want to? Keith, thank you. Would you mind introducing yourself, and please do respond either with ideas or views or suggestions.
Hi there, can you hear me all right?
We can, and who are you? What's your background, Keith?
Yeah, hi everybody. My name's Keith Harrison. I work in Dorset. I'm employed by, it's CCG money. I'm not technically a CCG employee because the GP practices at locality level fund my post, and I work with 17, across two localities, 17 GP practices. And I've been doing that for about 3 years, and started off as a part-time job. It's now a full-time job, I'm pleased to say. But the experience has been that, excuse me, in the main, I was really interested in Sophie's point. In the main, what we've been aiming for is a kind of bottom-up culture shift in terms of taking our practices along the journey of understanding what a PPG is about, and also patients who've responded positively to being invited to get involved, so that you can get that critical friend relationship between a representative group of patients and practice staff, primarily, as Paul said, the practice manager is the key party to that. And we've been seeing some positive success. What I'm still working towards is a kind of a parity across the whole of our CCG area, which is a pretty big CCG of 100 practices, and there isn't an equivalent post to mine yet anywhere else in Dorset. So I'm kind of keen to put that across as a mixed report from our sort of part of the world in terms of some very positive progress and some very dynamic now and well established and confident PPGs, but equally other parts of our immediate CCG area that aren't currently benefiting from that. And I do, without wishing to justify my own role, I do think a lot of that is to do with the additional capacity that my post has been able to provide.
Thank you, Keith. I'm just going to ask you a bit more about that, because I'm aware also we've got some people on the line from Somerset, and I've done some work in Somerset myself, and we've had a web seminar from the PPG chairs there. So I'd be interested in examples elsewhere as well as in Somerset. But let's just ask you, Keith. Don't be too modest. What do you think the extra thing you've done is that might have been made a success in terms of shifting the scene, if you like, of PPGs across the area from some good to some not being there to a better proportion? What have you done?
Well, I have, interestingly, I took part in that other web seminar.
You did,
yeah. You hosted, yeah, and yeah. Mostly because I, at an early stage in this post, have taken up this post. I established some contact with colleagues just over the border in Somerset, because I was aware that they were off to a quicker start than us in Dorset, and there was good practice to learn from, and still is. But interestingly, they do have a different model to some degree in terms of the PPG network in Somerset, as I understand it. Is well supported top to bottom within the CCG, but they don't necessarily have the same capacity on the ground as I'm currently able to provide in 2 of our localities in Dorset, in terms of attending PPG meetings and meeting with practice managers on a regular basis and being that kind of boots on the ground really, as opposed to providing from a CCG perspective, providing resource or support.
So you're there out and about. And what have you got a little? I'm putting you on the spot here, but have you got a little case study or story about just some small thing perhaps that made a difference from your being there?
Well, a lot of what I've done is to facilitate or try to facilitate the building of networks. So it's to encourage. We're quite a rural county, and geographically, it's not easy for people to meet or come across each other. Even within the locality of 9 GP practices. So, organising events and promoting events that provide that opportunity for people to simply talk to each other about what they're respectively doing, what they can learn from each other, and sharing that kind of peer support, both, and I apply that, to the PPG members themselves, but also to the practices and practice managers.
So, just in summary, your role has been taking people out of their own practice, whether they're the manager or practice manager or members, and creating some kind of informal networks with people who are doing the same work elsewhere in the locality. Is that right? So you're joining people up.
We've definitely found that's where I would point to that as being a key element of what I think is been successful.
There's also similar work. If I'm getting it right, I'm probably wrong, but it's either Reading or Swindon have done some very similar work as well, in creating a network of PPGs, whether it's formal or in your case perhaps starting off informal. Well, thank you, Keith. I'm just going to put you on mute again, but that was really interesting. Thank you. We've got some other hands up, and I wonder if I could just ask, and I acknowledge all of those, I wonder if I could just ask Sophie to elaborate on or say a little bit more about your experience of listening in to practice staff, Sophie.
My role currently is delivering training. I won't say where because I don't want to get finger pointed. But I have the opportunity to hear lots and lots of views of lots of different practice staff, and have them for a couple of years now. And there is a real variation in assumptions about the practice population's ability and capability to participate in decision making, in collaboration, in co-design, in involvement in a whole host of levels and areas of their own healthcare. And what we also see is a huge variation then in the activity of PPGs. And for me, the question sort of really is about how have people challenged the assumptions of the staff, because I think that it was a point that was made earlier that the PPGs have got really strong relationships with the practice staff, and the practice staff really value.
Just going to stop you there, Sophie, because it's a really poor line. You probably don't know that, so we can just pick up a few things. But I'm just going to pick up the phrase I heard there and open it up to others, Sophie. Sorry about the technical problem, but we could only just hear you. And ask if anybody has or has experience of challenging the assumptions that at worst from practice staff, and I'm only saying at worst, of course, any experience of challenging the assumptions that the public are either not well enough educated or well informed enough to have a role. Anybody want to chip in on that? Well, actually, I'm going to ask Paul first. Just a moment, Paul.
Thanks very much, Martin. I have to say I find this. I've heard this in lots of different organisations, not just about health. I think it is a really poor excuse, and it is patronising and insulting to suggest that people can't engage. That doesn't mean to say that it's easy. And I think the job for the organisation, and in this particular case we're talking about a GP practice, but I've seen it in other organisations that I've been responsible for engagement with what were perceived as challenging people who couldn't possibly contribute. The responsibility is for the organisation to make things as clear as is needed, to give the support that is needed in order for them to be able to participate as equals. And there has been a shift in some parts of healthcare. There are a good number of patient champions who are very adept at those challenges on an individual level. I think that a part of what we do is pick up on some of the points that Keith was making earlier about networking, and for the practice that says, oh, we can't possibly involve our local population in deciding about a particular change in a service that we're giving. If we're able to say, well, actually, in this part of the country, just down the road, there's a practice that did exactly that and did it well and engaged, and we get them to share those skills and work it from a positive perspective, I think that can make a real difference. But it is one of those things. I think Sophie was being quite gentle in the way she was summarising it. It's one of those things that I think is very poor practice, and it does need to be tackled. One of the ways of doing it is not just shouting as patients at the practice, but us being able to make use of other practices where we know that they have been able to do things well, and they can see that there's a real benefit from involvement in collaborative working.
Thank you, Paul. I want to take up some other subjects, and it feels like we're just touching the surface here, but I hope people are feeling that we're not just delving into problems, but at least there's some opportunity to feel positive about our roles here. We've got a really useful little piece of information from Sarah Wise. Thank you. I think it probably was Reading I was thinking of when I said earlier on Reading or Swindon. So some information there. And Sarah, if you could share that in terms of reference with me, I can make sure that goes out with all the information to everybody. I did want to pick up a couple more points from people. We haven't got too long, but Simon Chandler, I know you've put a couple of comments in the chat box, and one of them was around broadening the scope, if you like, of PPGs from beyond, and I'm only being flippant here, from beyond the colour of the wallpaper in the waiting room. Simon, do you want to say a little bit more, or?
Yeah, you said backgrounds. I'm the lay member for public engagement for Horsham Mid Sussex. I chair the patient representative group, commissioning patient representative group. We've got 23 practices. We get about 15 practices actually turn up with somebody, and probably only half of them are real PPGs as we would want them to be, so groups that actually work. And I'll put on the website Crawley Down, which is phenomenal. They have a phenomenal website, and they do phenomenal work for their practice, and their practice will say how good they are. But we've been working with the whole group. What does a good PPG look like? We've actually been having the CPRG people together, so the representatives of these 15 practices that attend, working on what it's like. And they've all said it's not funding, the chairs in the surgery. It can do that if it wants to, but it's much more about making sure there's an engagement with the population. That the CQC, when they come to talk in, there's an engagement, there's patients willing to talk to CQC and give the good stories about the practice. And the way most of the best practices work is they get doctors to actually talk to good people about would you not mind getting involved with being in the PPG? Could you help us with setting up the PPG? And that way you get the right sort of people onto a PPG, not the people who've got lots of time but actually haven't got the skill set to coordinate it, but you get people who actually have background in health or have background in public relations, understand the importance and actually how you get a committee together that works. And I think that's the big challenge. How do we get these committees to work? And then, the big discussions are, so we're going to merge 3 practices in your area in the next 5 years, or they will merge. We don't know why, but we know that they will merge because it's going to come down to retirements, etc. How do the PPGs get involved with what they want to see 5 years down the line in their area? And that's the sort of question they should be looking at, not the colour of the wallpaper.
Thank you, Simon. I'm getting more and more excited that we can share some of this information after the web seminar and with those who weren't able to attend, so I'll mention that before we end. I am beginning to build a conclusion from what some of you are saying, that one of the keys is to actually help a practice and an existing PPG, the practice manager perhaps, to see beyond their own organisation and see what happens elsewhere. And we heard from Keith earlier on that building networks If you've got the resource like Keith to do that, is great. We've had a note from Sarah around North and West Reading. Paul's reminded me that actually Swindon have done some good work on networking, and we've mentioned Somerset as a whole CCG as well.
Martin, could I
Paul.
chip in one really specific response to Simon? The fourth module of our Building Better Participation resource, Influencing Beyond the GP Practice, absolutely helps for a PPG that's been very practice focused to think, how can we play a part in the wider system and get engaged and potentially get involved. So if you're not familiar with it, I'd just mention that one.
That's excellent.
Right.
I need PPGs to exist to engage with, to then give them that. Let's be honest, that's the problem we've all got, is that actually most practices have a virtual list. Some practices have people who get together, 2 or 3 people who've probably done it for a long time. And then we get the practices that have excellent PPGs that really engage with that, engage with everyone else and do a fantastic job. And what we've got to do is lift everyone up.
Thank you, Simon. Thank you. And I just hope that today, you know, we've described some of the problems, but I hope we're beginning to hear that actually it's not like that everywhere, and it doesn't have to be like that everywhere. We've only got a couple of minutes, and I'm going to do that Jonathan Dimbleby thing, and say that although I'm sorry, Annie, that I think you took your hand down, perhaps in frustration, but we've only got one hand up, and that's Lydia. Have you got a very short question or statement, Lydia?
Hello, it's not Lydia, it's Erica Adams, and I'm the chairman of PPG.
Oh, sorry, yes, because you're sitting in the room together. Thank you, Erica. Yeah.
Well, yeah, we do get on very well, actually.
So we've got a practice manager and the chair of the PPG. You didn't know that, but I did. Sitting in the room. Thank you.
I was especially interested in the project that has gone on in Oxford of a proper research program. This I know was into maternity services, but it could be any number of services. I don't know whether it's possible that they could send around by yourselves some information as to how they set about it, because it's a very technical thing to do, a major piece of research like that. But I think it would be absolutely wonderful if we could, all of us, think about it and who we could engage with to help us take on a particular project. I mean, I have no particular project at the moment, but this is something we could talk about. Anyway,
so this was... You. No, thank you, Erica. So this was research done on recruiting. It was PPG to look at.
It was to do with maternity services, I think, in Oxford, and it came up. The chairman brought it up earlier, and it was obviously a major thing. I mean, obviously being located in Oxford might be quite helpful because you've got people who would perhaps guide you.
I can. What I can do is I will make sure that, Martin, I send you some of the press release that was done because it won an award, and there were some joint press releases, and that would identify the practice a bit more about what they were doing, and I'm sure they would have no problem with being contacted to understand a bit more detail about it.
Thank you very much, Paul. And we just had a very helpful little bulletin from Simon in the chat box telling us that the best PPG in Mid-Sussex, or one of the best rather, with a link. I was very tempted to click on it, but I need to get on with my job of chairing. So thank you for that, Simon. I'm just going to, it feels we've only just touched the surface here, but it has only been an hour. So I'm going to just wind up by saying a couple of things about how to continue to learn and take action on this important topic. I'm going to invite you, and we've had a few in the chat box already, to send in any to myself by email, Martin Howard, any resources or links or reports of best practice or ideas that you want to, that you're willing to share, because we've only heard the tip of those, I think, today. So if you were able to do that in the next working week or so. Following that, a little bit later on in September, we will put all of those on our website on a special page around participation in primary care. And also we'll put the recording and the notes for today and the slides, and anything that isn't confidential that came out of the chat box as well. So that's my invitation to you to share some of the resources more widely. And then I'll make sure, of course, that before the end of September, that everybody who's taken part today, and those who couldn't come as well, we've had a few apologies, gets to see those. And again, you could share those with your colleagues. So we've had a really diverse group here today. I think I'm counted about 27 of us. So I hope 27 of you have found that useful. They've only just touched the surface, I think, of moving from identifying some of the best practice, but also identifying some of the problems which will never perhaps disappear, but each of you in your own way, whether you're working in a PPG or in a different role, are determined, I think that's what I've heard, determined to make it work better and more often and in more places, in order ultimately to make the experience of people, either ourselves as patients, or those who perhaps require more explicit and focused services, really get what they need in primary care, and that it's not just for the middle classes, as we might say. So we've had a thank you from one or two people, and of course a thank you from Paul. I'm just going to pass over to him to say thank you and goodbye in a moment. But as I say, we'll send some information out when you've sent some to us, if you have. But we'll also ask you to just fill in a very quick evaluation, and we can then make sure that you hear about future web seminars on different topics all around patient participation. So, Paul, did you want to say a last word before we
Thank you very much. I've really enjoyed that. Absolutely a key takeaway, if you like, for me is the importance of networking, sharing good practice, best practice, as a way to bring people up, rather than just beating up people who aren't doing so well with their practice. And just to say, I did send a quick note back to Jane, who'd asked about individual membership of NAP, and to say that whilst we don't have that, individual members of a PPG who is a NAP member will be able to get given the password to access membership areas on our website. So if your PPG is a member, then you can access all of that, but you'd have to speak with them about getting the appropriate password. But thanks very much, everybody. I look forward to seeing more that's coming through over the next week and continuing to share all our good practice.
Good. Thank you, Paul. Thank you to all of you for taking part and being so interested. To leave the meeting, look at the very top left-hand corner under File, if you haven't done that already, and the bottom option is Leave the Meeting. So if you want to do that, thank you once again, and hope to see you on some future web seminars or using our website, Patient Voice South. Thank you.